Good afternoon, sir.
You will ask, good afternoon.
Good
Here
afternoon.
it's yeah, it's good.
Good
Here
afternoon.
it's good morning.
Good morning, sir.
In Pakistan, it's good afternoon. Yeah, it's the same. Yeah.
Yes, sir. It's afternoon. I welcome you in this webinar of career counseling, and it's an honor for us to have you on board. And sir, I would like you to introduce yourself and tell us about yourself and your experiences. Over to you, sir.
Thank you, Dr. Adnan, for inviting me. I mean, I'm really amazed by the work you are doing in back in Pakistan. I mean, lovely. You are doing a lot of great jobs, a lot of great extracurricular activities. You are doing great job in ophthalmology. So my name is Dr. Shakeel Ahmed. Currently, I am a glaucoma fellow in Pips Cross Hospital, which is a NHS trust in London. I did my fellowship in ophthalmology back in Pakistan from 2013 to 2017. I passed my FCPS. Then I decided to come to UK. I passed my MRCS at Edinburgh in 2018. At that time, the GMC was recognizing the MRCS Edinburgh to get GMC registration, but unfortunately, at the moment, the MRCS Edinburgh is not recognized. So I got GMC registration on the basis of MRCS Edinburgh. Then I joined the NHS in 2020 as a cataract fellow in one of the NHS trusts. So I did 1 year fellowship in cataract. After that, I went to another trust to have my corneal fellowship. So I did 1 year fellowship in cataract, 1 year fellowship in cornea. Now I'm doing my third fellowship, which is a glaucoma fellowship. So my aim is to get all the fellowships done, especially in the interior segment, which is my interest. Yeah, that's all about myself.
Sir, I would like to ask, you did FCPS training from which institute and which city?
Uh, my training was in Services Hospital, Lahore, and that duration was July 2013 to July 2017.
Okay, sir. So, sir, you came to London, to UK in NHS Trust by means of MTI program, or you applied yourself in the UK system?
No. I came to UK by getting a full GMC registration on the basis of MRCS Edinburgh. I did MRCS in 2018. So at that time, we were able to get GMC registration on the basis of MRCS Edinburgh. So I came through my own way. It's not MTI route.
Okay, sir. Sir, so how was your experience in Pakistan and how was your experience in UK? Currently, you are practicing there. And what are the difference and key differences in the residency program in Pakistan and in UK?
Uh, there's a lot of difference, believe me. I
Yes,
mean,
sir.
if even if you are a full trained doctor back in Pakistan, and if you will come and start working in NHS, you will be lost. I mean, the system is totally different here. Back in Pakistan, there is a paperwork, but here everything is on computer. There is more surveillance on you. You are more accountable here in UK rather than back in Pakistan. In terms of training, uh, in Pakistan, I mean, you trained in a one department, and if you are lucky that that department has all the subspecialties, then you would be trained in a very good way. But unfortunately, most of the doctors who are doing training back in Pakistan in any department, I mean, that department is good in only one subspecialties. Like I did my training in Services Hospital, which was good in vitreoretina, but there were a couple of subspecialties which were missing there. So I had theoretical knowledge of those subspecialties, but from practical point of view, I did not get that much exposure. So this is the one thing which we are facing back in Pakistan. But here in UK, the person, the doctor who is in training program, they rotate every year in different department, and it's compulsory for all of them to spend at least 6 months in all subspecialties like cornea, glaucoma, vitreoretina, medical retina, neuroophthalmology, pediatric ophthalmology, oculoplasty. So here they spend at least 6 months in every subspecialty, and they get a lot of exposure for every subspecialty. So they have a better grip and they have a better understanding about all those subspecialties. So this is the main difference between our training and here training. Yeah.
Sir, you cleared MRCS Edinburgh while being in training in Pakistan, or you cleared MRCS Edinburgh after your FCPS?
Uh, I did my MRCS Edinburgh first, then I did my FCPS. So I completed my MRCS in March 2018, and I passed my FCPS in November 2018. In fact, in March 2018, the both dates were overlapped. I mean, I had a choice whether to go for MRCS Edinburgh or FCPS ophthalmology. So at that time, I chose MRCS over FCPS because of certain reasons, because I had paid a lot of money, I had all those things, my visa, my tickets, everything. I had paid a lot of money, so I decided to go for MRCS rather than FCPS because both exams were on the same date.
Yes, sir. Sir, my second question to you is there is also a post fellowship system or program in by CPSP, and also there as you opted for, you went to the UK and you did their fellowship 1 year in each specialty. So what you see in both fellowship program, that CPSP fellowship, post fellowship, and in the UK in different specialties.
So one difference between MTI route and your own route, if you get the full GMC registration, is you can only work for up to 2 years through MTI route, then you have to go back to Pakistan. But if you get GMC registration by your own mean, then there's no obligation. You can stay in UK forever. So this is the one difference. Apart from that, if you are doing fellowship, it doesn't matter really through which route you are in. One thing which I have seen here, that if a person comes through MTI route, the NHS Trust, they first treat that person as SHO at a junior level, even if he is a FCPS ophthalmologist back in Pakistan. Through MTI route, they will treat you as an SHO for a couple of months, then they will promote you to a fellow. So, I mean, if you are working as an SHO, obviously you won't be able to get any surgical exposure. But once you will be promoted to a fellowship, then you will get surgical exposure. So this is one difference between MTI and your own. If you go through your own way and you are competent enough, then they will start giving you surgery from the very first day, and they will treat you like a proper fellow. I mean, I joined cataract fellow or corneal fellow as a senior corneal fellow and senior cataract fellow. So they started giving me surgery from the very first month. So I got a lot of corneal and cataract surgical exposure. You will get obviously clinical exposure. It doesn't matter whether you are a SHO or junior fellow or senior fellow. Everyone will get equal clinical opportunity. So it comes on the surgical point of view. So MTI route, you will come for 2 years. You will spend some of your time as SHO level, then you will be promoted, and then you will get exposure. So it's good in both ways. I mean, if someone wants to come through MTI route, it's a very good system. Please come in, have exposure of the NHS. That is a lovely exposure. And another thing I want to tell, I mean, if you're doing fellowship, it really depends upon the department as well. Some department, they are not good in certain fellowships. It really depends upon the attitude of your consultant on where you are working with. I mean, if they are good if they are supportive and if they can give you free hand, you will learn a lot of things. But if you will work with a consultant who is very choosy, who is very fearful, and then that fellowship won't be good from surgical point of view. So it really doesn't. If you, if both fellows through MTI route and through other route, they are working in a very good department, they will get equal opportunity. It really depends upon the department. But I would suggest, if you are in Pakistan and if you wanna, please come in UK and have a experience at least for 1 to 2 years. It will really make a difference.
Thank you, sir. Sir, one another question is, as per my knowledge is concerned, through MTI program, UK government don't offer citizenship, I guess. But while coming to the GMC program, and if one fulfill the 5 year requirement of the staying in the UK continuously, they offer you the permanent residency. So I wanted you
You are,
to highlight this thing, and how much it is
yeah,
benefit for Pakistanis to come there.
you are right. Obviously, to be a citizen here, you have to spend at least 5 to 6 years. After 5 years, you will get ILR, which is indefinite leave to remain in UK. And after 1 year or so, so after 6 years, you will get UK passport. So minimum requirement is 5 to 6 years to stay in UK to get this citizenship. Through MTI route, as I said, that route is for 2 years. After that, you have to leave the UK. So you will not be able to fulfill that requirement. So you won't be able to get the citizenship. This is one thing. And citizenship, I mean, it really depends upon everyone's own choice. I mean, if someone is very patriotic and he says, no, I love my country, I love Pakistan, I don't want to get any other citizenship, I mean, this is not good for him. But if someone who wants, okay, I should have the UK citizenship as well, this is good for myself or even for my children, my family. So I would suggest it's good to have the UK citizenship, and this is the another benefit of working in NHS for up to 6 years. I met many Pakistanis here. Uh, their aim is to get the uh, citizenship. Then their plan is to go back to Pakistan. So they are working in NHS, getting experience, and they are waiting for their citizenship so that they can go to anywhere in the world. And yeah, this is the whole story.
Yes, sir. Thank you, sir. Sir, now I would like to know about your journey from learning from MRCs Edinburgh till now. How you proceed your process, and what are the hurdles and difficulties you come across in your way to today, and what you will suggest or guide the young fellows or the young people who are working or planning to come in UK. Over to you, sir.
Okay, so my advice to the young ophthalmologist there is, please plan ahead. What do you want in life? Please plan ahead. You should know that what you will be doing in the next 5 to 10 years. If your plan is to move to UK, then start doing the exams like FRCS Edinburgh, FRCS Glasgow, FRCS London. In your fellowship, I mean, you have to go through your FCPS route as well. You have to pass them, IMM, then FCPS. Then please start this process side by side, so that by the time your training finished, you would have the most of the other the degree like FCPS, FRCS as well in your hand. I mean, it might take a little bit longer than 4 year, but it's fine. But you need to start your journey early. So you need to plan ahead. And I would suggest to all the young ophthalmologists, if you are planning to do the FRCS and you are confused that which FRCS you should do, like FRCS Edinburgh, FRCS Glasgow, or FRCS of London. So I would suggest them all to do FRC of London. Why? Because here in UK, if you want to work as a consultant, you have to pass FRC of London. It doesn't matter whether you have ophthalmologist who wants to come in UK and wants to become a consultant here, then they need to plan ahead. They should know that what are the different routes to become a consultant here. I was telling about those three different routes. One is CCT, one is Caesar CP, and third one is Caesar. So, first, if someone has experience in ophthalmology and that experience is more than 24 hours, then that person cannot enter in CCT. So we will not talk about the CCT. So let's talk about Caesar CP and Caesar. So Caesar CP is some kind of a mixed training. I mean, if a person has some training which is non-UK based and he wants to do some training in UK, then at the end of the training he will get CCT through that Caesar CP route. So if you are an ophthalmologist, you have experience of more than 24 hours, 24 months, and you want to get training in UK in ophthalmology, then you can apply for training from ST3. For that, you need to build up your portfolio. I have a slide for that I want to open. I mean, if anyone is planning to come to UK and to get training into ST3, I would suggest them to participate in presentations, in poster presentations, in oral presentations. They need to publish, they need to participate in education and training, like they need to write down a book or a chapter in a book. They have to attend certain teaching courses. I mean, all these things, and in Pakistan, there's no concept of audit projects or quality improvement projects. But if you can do any of these projects back in Pakistan, I mean, you need to start build up your portfolio if you want to get training in UK and you want to be a consultant through Caesar and CP route. Another route is just a Caesar route, in which you have to collect the competencies from different consultants by doing different fellowships in all the subspecialty areas. For that, you don't need to build up your portfolio. So this is something for the young ophthalmologist. Plan ahead. If your plan is to just get the exposure of NHS and you want to go back to Pakistan, then you don't need to build up your portfolio. Just concentrate on your FCPS, find a route so that you can enter in NHS and go back to Pakistan. But if you're planning to come to UK and you want to stay in UK forever, then you need to be a consultant. If you want to be, I mean, there are different routes as well. If you don't want to be a consultant, then you can work as a specialty doctor or associate specialist. But if you want to be a consultant, then please start building up your portfolio, start doing FRCS London as well.
Sir, I wanted to ask, you talked about Caesar CP pathway and Caesar pathway. Sir, for the Caesar CP pathway, is FRC opt is necessary or not?
To enter into Caesar CP pathway, FRC of part 1 is necessary. Without that, you cannot enter into the training program. So for entry into the training, you need FRC of part 1. But before finishing your training in 5 years, you have to pass the complete FRC of. So FRC of is necessary, because without that you cannot be a consultant in UK even if you have done your training in UK. So FRC of is compulsory, but to enter into the training, one of the essential criteria is FRC of part 1.
Sir, what is the difference between Caesar CP pathway and Caesar pathway?
Caesar CP pathway, I mean, at the end of Caesar CP pathway you will get CCT, which means in Caesar CP pathway, you will enter into the UK training system through ST3 till ST7. So you have to do 5-year training in UK. The first 2 years will be exempted, but you have to complete 5-year training in UK so that you can get CCT through Caesar CP pathway. Caesar is something else. Caesar CP is combination of both non-UK training and UK training. The first 2 years, they will consider that you have done training in Pakistan, so they will exempt you from first 2 year from ST1 and ST2. So you have to start from ST3. Caesar is a totally different game. In Caesar, you are not in a training program, you are not protected. All the effort you have to do by yourself. You have to get all the competencies. Like to be a consultant in UK, you have to do at least 350 cataract surgeries. So in Caesar pathway, in which you are not in a training program, you have to hunt, you have to do these surgery by yourself. You have to find the department which is good in giving you cataract surgeries. And then glaucoma, I mean, you have to do at least 30 glaucoma surgeries. This is the requirement for being a consultant in UK. In Caesar pathway, you are not in a training program. They are not uh, bound to give you 30 glaucoma surgery. So you have to do something else to get this competency, like I am doing. I'm doing glaucoma fellowship to get that competencies. Then you have to do at least a couple of corneal surgeries, 20 or 20 or 30, I guess, eyelid procedures, 10 squint surgeries. I mean, this to build up this surgical portfolio, if you're not in a training program, it's a little bit hard. Then you have to hunt for different fellowships to get all these competencies, or you have to find the department that is Caesar supportive. Then you can get all these competencies. So Caesar is something which is not protected by the system here. So you have to do everything by yourself, and you are not protected, you are not supportive, you have to put extra effort. But Caesar CP mean you are in their training program. They are bound to give you surgery. They are bound to give you all the exposure to get all these competencies done. So Caesar CP is much better pathway to be a consultant here than Caesar, which is all you have to do by yourself.
Thank you, Sam. Sir, my another question is, for example, if anybody is doing a Caesar pathway, is it necessary for the Caesar pathway only to he or she should have passed the FRC off exam, or is it not necessary? Any Royal College exam can be.
No. FRC off is compulsory, whether you are doing training through CCT pathway, through Caesar CP pathway, or through just Caesar pathway. The If someone has FRC of Edinburgh and that person got that degree prior to 2002, then the that is eligible to be a consultant. After 2002, everyone, like, this is not the option for young ophthalmologists. So for us, we have to pass uh, FRC of London to be a consultant. It doesn't matter which route you are.
Okay, sir. Sir, you are currently working in UK at which post?
I'm a senior glaucoma fellow.
So you, after getting GMC registration, you directly applied for a senior fellow, or means you promoted to that level from very junior, from very bottom?
Yeah, this is another advice I want to tell all the doctors in who are doing ophthalmology training back in Pakistan. Please get your cataract skills done. You should be a good cataract surgeon. If you are good in cataract surgery, here in UK, they will treat you in a different way. Because I had done almost 2,000 or even more cataract surgery, phacoemulsification back in Pakistan. So I directly applied for a fellowship. When I came to UK, that fellowship was a cataract fellow, senior cataract fellowship, and we were 3 cataract fellows. One of my colleague, she was not good in cataract surgery, so they did not bother to give her any surgery. But I was good in cataract surgery, so they started giving me a lot of cataract lists. So be so if you are skilled surgically, particularly the cataract surgery is, if your cataract surgery is good, then you can get a very good fellowship here in UK, because here they will teach you everything, they will give you exposure of everything if you are a good cataract surgeon. If you're not a good cataract surgeon, then this is a big headache for them. I mean, they won't bother, they won't give you any, and you won't be able to get a good fellowship. I did corneal fellowship as well. So I got the corneal fellowship on the basis of my cataract skills. When I joined as a corneal fellow, senior corneal fellow, my consultant told me that he hired me because of the cataract surgery. If you are a good cataract surgeon, it's easy for my consultant to train me the different keratoplasties. I mean, PKP, DMEC, DSEC, and everything, you know. So I joined NHS at a senior level, but for that, I would suggest every one of you to be a good, I mean, you have to be a good cataract surgeon for that, you know.
Thank you, sir. So, very good advice you were given. Cataract surgery is a very big dilemma in Pakistan residency training as well. So, any sir,
Yeah.
any particular number of surgery that should be done by a resident or a person who is willing to come in UK? Any numbers like in competency? They ask around about 350 surgeries, I guess, from the cataract.
350 surgeries. Yeah. You know, number doesn't matter. I mean, if you are a good cataract surgeon, you are a safe. The thing which matters is whether you are a good cataract surgeon, whether you are a safe cataract surgeon, whether you know your limitations, and whether you can deal the complications if happens during the cataract surgery. This thing matters. Number doesn't matter. I mean, in Pakistan there are a lot of camps in which you will go and you can do, but people are doing 100 cataract surgeries per day. So number doesn't matter. The thing which matters is your skill, your safety. So be a good, safe cataract surgeon. If you think that you are a good and safe cataract surgeon, that is enough. I mean, if even if you have done 300 surgeries, that's fine.
Okay, sir. Sir, I wanted to ask after getting GMC registration, the posts are announced, then we have to apply for as a clinical fellow, or there's another way or another pathway by the which you have taken and we can apply by means of it.
So there is a website called NHS Jobs website, NHS Jobs website. So you need to go there, you need to make your account there, and after that you can start hunting for the jobs. Once you will make an account on NHS Jobs website, there's a search column. You need to write down ophthalmology, and there would be loads of posts. I mean, there are always like 60 to 65 jobs available on NHS for ophthalmologist all the time. So you need to go there and you will find all kind of jobs: consultant ophthalmologist, specialty doctor, clinical fellow, junior fellow, senior fellow, associate specialist in ophthalmology, everything. So it's really upon your interest, what do you want. My suggestion is, so the to the question, so when I was applying for my GMC registration, when I had everything, I had MRCS degree in my hand, I had English competency, which was OET in my hand. So when I was in the process of GMC, I started applying for the job, uh, because it will take a couple of months. If you will apply for a job, the interview would be within a couple of months, 2 or 3 months. So while you are in a process of GMC registration, go to the NHS Jobs website, make an account, and start applying for the jobs.
Okay, sir. So, sir, I wanted to ask what are the system of promotion or hierarchy in NHS UK ophthalmology specialty like SHO, junior fellow, then senior fellow, and a consultant. We would like to ask you what are their system of promotions or hierarchy or the chain of leadership.
Yeah. So here in UK, if you want to be a consultant, as I said, you have to uh, get specialist registration in GMC. So that is a different route. For that, you have to do these things. if you if you're not CCT, if you're not CCT CP and you have not completed the CZ pathway, you cannot be a permanent consultant there. So let me tell you the hierarchy. I mean, anyone could be SHO, and after a couple of years, even 1 year or so, if you got some exposure, they can give you junior clinical fellow post. But if you're coming from Pakistan and you have experience of 4 year, like 4 year ophthalmology FCPS training, then you can directly apply for senior clinical fellow or specialty doctor. They both are different route. So if you want to, so you can be, if you've done 4 year training in Pakistan, you can be a junior clinical fellow, you can apply for senior clinical fellow, you can apply for specialty doctor, even you can apply for associate specialist and locum consultant. You can apply for these, you are eligible to apply for these jobs. But I would suggest not go for associate specialist or locum consultant job in UK if you don't have NHS experience. So there's no proper, I mean, it's not, system is here is not like if you are a specialty doctor, okay, if you will spend 2 years in specialty, you will be automatically promoted to associate specialist. No, things don't work here in this way. You have to make your own effort. I mean, if you're a clinical fellow, you have to plan ahead. What is your aim? You want to end up as a consultant, then you have to make an effort. Otherwise, there's no proper promotion system in UK. So you have to make an effort by yourself. You know what I mean?
Yes, sir. So you told us about the clinical senior clinical fellow and a specialty doctor. So what's the difference between in both of them?
There's a big difference. In my opinion, it's a big difference. If you want to learn, please get the post of clinical fellow. So what is the advantage of clinical fellow? You will learn a lot. Clinical fellow mean you are fellow in particular subspecialties, like a corneal fellow. You are working all the time in cornea, you are doing corneal clinics, you are with consultant all the time in corneal theater. So you are getting clinical exposure and surgical exposure in cornea all the time. So by the end of fellowship, you would be good in cornea. So you will learn. The consultant will give you surgery, he will teach you in clinic, he will teach you in theater. So he will uh, treat you like a trainee, and you will learn these things. On the other hand, if you are a specialty doctor, you are a service doctor for them. No one will teach you, no one will train you surgery. If you are specialty doctor, can only do cataract surgery. If you're a good cataract surgeon, okay, they will give you cataract surgeon surgery, and you will be doing service job. Sometime you are doing this clinic, sometime that clinic. I mean, if they are there is shortage of doctor in some area, they will send you there. So you are like a service doctor in specialty. But in clinical fellow, you are working in a particular subspecialty, and you are learning a lot of uh, stuff there, you know. But another, the good thing regarding specialty doctor is you will be permanent. This is a permanent post, specialty doctor, but fellowship post is not permanent. This is fixed term, 1 year or 2 year fellowship. After that, you have to move or you have to do something else. You know, you have to move to some. If someone wants to stay at one place permanently, then specialty doctor is fine. But you are learning. I mean, you won't learn anything. But in fellowship, you will learn, but that is not a permanent post.
Okay, sir. So, a step ahead of a senior clinical fellow, we got another post of associate specialist or locum consultant. You told us. So, is that the next step from senior clinical fellow?
Uh, yeah. If you are a senior clinical fellow and you have done enough work in like if I'm a corneal fellow and I have done 1 year corneal fellowship, and I know that I can work as a consultant in cornea, then I can apply for locum corneal consultant. Again, that locum corneal consultant post is fixed term post. The maximum duration is 2 years. The same hospital cannot hire you more than 2 years as a locum consultant. So you can work as a locum consultant after getting senior clinical fellowship in one subspecialty, but that post is fixed term. So after 2 years, you have to move somewhere else. Uh, Associate specialist is between fellowship and consultant. This is a something in between. So associate specialist, pay of associate specialist is almost equal to consultant, but you are not a consultant. So you will get pay almost equal to consultant. You will be considered senior in the department, and that post is again a permanent post. So after getting fellowships, you are not, if you're not planning to do the Caesar CCT pathway, then you have two options: one associate specialist, one locum consultant. Associate specialist, you will be permanent at one place, you will earn enough money, you will have a good life, and the consultant has a lot of responsibility. You don't have those responsibility. You're living a good life. But the locum consultant post, you are they will treat you like a consultant, but this is a fixed term, 2 years. After 2 years, you have to leave that trust, you have to go somewhere, you have to move your stuff, you have to do the shifting and everything.
Okay, sir. So what is the process from promoting from senior clinical fellow to the associate specialist? Are there some particular requirements?
There's no particular requirement. If you think, if you believe that yes, I am eligible for associate specialist, whenever the job will come, you will apply, and they will see your CV, your portfolio, and they will think that you are eligible. They will call you. There's no particular numbers. There's no particular experience you need for to be an associate specialist. If you don't have any UK exposure, you are back in Pakistan and you want to apply for associate specialist, apply. So there's no such proper requirement for that.
Sir, you talk about portfolio. Sir, I would like to you to highlight plus what are the particular credentials or the things to be prepared in the portfolio if anybody is willing to come in UK and to be on a safe side. You should pre-plan those things.
Yeah, I mean, portfolio is required if you want to enter into the training here. So for that, if you have any prizes, if you are first in, you have to be, there are 5 numbers for prizes. Like if you are first in your undergraduate degree, you have got first prize, you have got distinction, they will give you 1 mark. If you have presented a topic at national level, international level, even at regional level, and you got the first prize, so that is 1 number for your portfolio. You have done, you have presented a poster presentation and you got the first prize, that is your 1 number on your portfolio. So there are 5 numbers for your prizes. Then there are 5 numbers for your OLR present. If you have presented any case, it doesn't matter whether you got first position or not. That will also count one portfolio. So you have to present as many cases at national level, regional level, international level to get all these things done. Another thing is, uh, you need to have a quality. If you have any quality improvement project, like if you have done any audit, the UK, they love audit. I mean, if you have any audit in your portfolio, if you've done any audit back in Pakistan, that would be counted. They will give you straight away 5 numbers for that audit. If you've done publications, there is 1 number for every publication. So maximum number you can achieve 5. So you need to build up, and there are 14 numbers for your ophthalmology career as well. I mean, if you have done uh, cataract surgeries, you're a good cataract surgeon, and your supervisor signed, yes, this is a good cataract surgeon, this is 1 number. If you've done 20 PRP and capsulotomy, this is 1 number. If you've done 10 eyelid procedures, this is 1 number. So you need to maintain portfolio both in ophthalmology career and in all these activities like presentations, posters, publications, got prizes. I mean, all this stuff you need to build up your portfolio.
Okay, sir, can you please tell us the source from where we can exactly get what numbers and what things are specified for building up the portfolios? Like exactly you are referring 20 PRP inject lasers and 10 eyelid surgery. If anybody wanted to explore more about the requirements in the portfolio things, so where can we get these numbers or these list?
Yeah, so on Google, if you will type, let me type it here, then I will be answer. So what you need to do is just type on Google uh, ST3 evidence. Let me know. Yeah, ST3 ophthalmology evidence folder. If someone will write down this thing on internet, ST3 ophthalmology evidence folder. So on this he will get all the information regarding that, what you need, how many cataract surgeries, and I mean everything regarding portfolio. They can get it on that website if they will write down ST3 evidence, ST3 ophthalmology evidence folder.
Okay, sir. So thank you for this.
We can share a link. I mean, I will find out and I can send you the link, and we can share the link below this video for those who wants to see.
Okay, sir. Thank you, sir. Sir, another question I would like to ask. In Pakistan, there is a concept of post fellowship, but it's a very underdeveloped system. Trainees here are not satisfied with the post fellowship. Another option we got, as you have told us about the Caesar pathway. Another option, without anybody not willing to go give a first year of examination, he can be come via getting a GMC registration. So, sir, after you have gone through all this time and you have gone through all this experience, now what is your final words for young people? Which pathway should they opt for if they wanted to? Because now this is an era of subspecialty, and everybody they ask a subspecialist instead of being a general ophthalmologist. So, what thing matters most in recognizing themselves as a subspecialist, and which one should we opt for?
Uh, I mean, yeah, I agree with you. This is the era of subspecialty. I mean, general ophthalmologist has very little space nowadays, and I agree with you that most of us we are not satisfied with our post fellowship back in Pakistan. I also started a vitreoretina post fellowship back in Pakistan, but I have to quit in the middle because I was not satisfied with that. So it really depends upon your planning. If your planning is to get the training in one subspecialty, and if you want to work in Pakistan, then you can come in UK through different routes, and you can do fellowship in your subspecialty of interest, and you can go back to Pakistan and start practicing there. This is a very good thing. I know my colleague who is doing corneal fellowships. So now he is doing third corneal fellowship. His plan is to go back to Pakistan and start practicing the cornea related clinic. So this is one way you have to plan ahead. If your plan is to work in Pakistan, come here, get exposure of your specialty of interest, go back to Pakistan and start working. And another option is if you want to stay in UK, then this is a different game, you know.
Okay, sir. So, after what are the minimum time duration of fellowship in UK, and after completing that time, are we awarded with a fellowship certificate or any like a post-nominal or any diploma certificate like this?
Minimum duration of fellowship is 6 months, but most of the fellowships are for 1 year, and maximum duration is for 2 years. So once you have done a fellowship, uh, that department, that hospital, you can ask them and they will give you a certificate of completion of this fellowship. And that is uh, that's worth, I mean, you don't need to worried about that you did something else. One thing is the department, they will give you the certificate of completion of your fellowship. Another thing, you can ask your consultant as well to give you uh, some kind of a certificate regarding your fellowships. I mean, if you have done fellowship here in UK, you don't need anything else. That thing is enough.
Absolutely, sir. Sir, I also would like to ask about family, because if anybody is coming to UK for more than some particular time, like 1 year, 2 year, the family is the main issue. So, what are the facilities that a family can avail? Can we call our family in the UK? Can is any means facility that the UK government or the NH system provide to our family? What are the system and the family life over there in the UK?
Uh, I have a family with me here in UK, and I am satisfied with that. This is one thing. In UK, uh, you can invite your family. Your family would have, your child would have free education, free healthcare facility for all of you, for your wife, for your children. Not for your parents. For the parents, it's a different game. I mean, they won't consider. But for your children and for your wife, you can invite them on your dependent visa, and they are eligible for all the healthcare facilities, child care facilities, all the facilities which the UK national is enjoying. Most of those facilities you can enjoy here for your children and for your dependents. Uh, if someone wants to invite their parents, then here comes the difficulty. We know that we have parents, and most of us, we don't want our parents to leave behind, or at least we want them to come here and stay some time with us. For parents, you have to apply for visit visa, and you know that visit visa would be at least for 6 months, and sometime those visas get rejected as well. So some people here are struggling from their parents' point of view, but their children, and it's a good system, and they will support you in your children and your family, but not for the parents, unfortunately.
Thank you, sir. Sir, another question was that are you planning? Have you given any FRC opt exam, or are you planning to do so?
Yes, I have passed FRC of part one refraction and part two written. So my plan is to appear in part two, practical exam at some point. Because this is compulsory here in UK. If you want to be a consultant at some point, you can't skip the FRC of the exam.
So you did exam FRC opt exam after coming to the UK. Wasn't it that difficult studying the basic after leaving it for some time?
Yeah, when I came to UK, I mean, prior to coming to UK, I didn't have any knowledge. I mean, just came and I started working here. It's doable. I would say it's doable. The most difficult thing for me was FRCS part one. That is a basic, and we are way away from basic. We studied our basic in 2000. I studied in 2013. So giving
Exactly.
another basic exam in 2022, 21, 2020, that was quite difficult. Apart from part one, the refraction exam was very easy, and part two, if you're working in a department, I mean, that is not that much difficult. I will see what will happen in practical, but apart from part one, it's doable. It's doable.
Okay, sir. Sir, so thank you very much, sir, for your time, valuable time, and it was very knowledgeable. I come across very new thing and very knowledgeable things, and it will. I'm very sure it will help our young generation, young ophthalmologists to come and pursue their career in the UK. And I also would like to have another webinar with you on FRC opt preparation as well very soon at a suitable time. And so, any last ending remarks you would like to suggest to the young people doing residency in Pakistan, because there's a lot of depression in Pakistan, and variability of the training methodology, and the people are not getting trained or they are under trained. So what you will suggest to them, because they got an exam very soon and they are under trained, how they can make most of the training in Pakistan?
First of all, thank you so much for inviting me for this webinar. I mean, it was very lovely, and I'm amazed to see is to hear that you are doing so much work, for these young ophthalmologists. So my advice to the young ophthalmologists is, yes, I agree. There is a lot of depression back in Pakistan. We are not getting enough clinical exposure, surgical exposure. Even after doing the FCPC exam, there are not that much jobs. There is no exposure, so we are struggling there. So my advice is you have to plan ahead. You should know that what is your aim, where do you want yourself to be after 5 year or 10 year. So there are two things: whether you want to stay in Pakistan, you want to move out of the Pakistan. These are, it really depends upon you. If you want to stay in Pakistan, focus on your ophthalmology training, get as much surgical exposure as you want. But I would suggest that please come to UK, get an NHS experience in different subspecialties, or at least in subspecialty of your interest. Get experience here at least for 2 years, not 1 year, at least for 2 years in your subspecialty of interest. Then go back to Pakistan, and believe me, you would be a different doctor. Your approach would be different. You would be much more safe doctor. You will feel yourself, even if no one uh, uh, will be will ask you to be accountable, but you will feel that, yes, this patient, I am accountable for this patient. So your approach will change, and you will be a good doctor. So even if you want to stay in Pakistan, stay in Pakistan, serve the community, but please come to UK, get an exposure, then go back to Pakistan. You would be a different doctor. Another young ophthalmologist who wants to move to UK, then really they need to search everything. What are the different routes? How can they get these different things? They need to. Internet is a very good tool. And another thing, I would suggest all of the young ophthalmologists to join IMG Facebook group. I think do you know about that group?
Yes, sir.
I would suggest everyone to join that group. I mean, on that group, you will find a lot of information. Some of them would be depressive, some of them would be supportive. But join that group. That would be helpful for every one of you. So plan ahead. You should know that what you want to do in your life. Even if you want to stay in Pakistan, but please come into UK, get some exposure, go back to Pakistan and serve the community.
Yes, sir. Thank you, sir. Thank you for your time, and it was very lovely to hear you. And sir, it's an honor to have you in this afternoon, and may God bless you, sir. And thank you very much, sir. Allah Hafiz.
Thank you. Allah Hafiz.
Allah Hafiz.